Thank you, Presiding Officer. Thank you, Julie, for raising this important issue. First Minister, the best thing the Welsh Government can do to support people with brain tumors is to ensure that they receive, as you earlier said, an early diagnosis and swift treatment. Cancer research and academia are searching for better treatment and a cure, but it falls to government to ensure that the best chances for survival for those who develop such tumors. And in this, we are failing. We have seen around a 40% increase in the incidence of primary brain tumors over the past 30 years. Survival rates for brain tumor patients have barely improved over the time period, and survival rates for the most aggressive tumor remains around 10%. And the reason appears to be a shortage in the diagnostic workforce. According to a recent report by the Royal College of Radiologists, there is a staggering 34% shortfall in clinical radiologists and 12% shortfall in clinical oncologists. If immediate action is not taken, the workforce shortfalls in clinical radiology and clinical oncology are projected to rise to 28 and 38%, respectively, by 2028, the largest shortfall in all 4 UK nations. Therefore, First Minister, what urgent actions are you taking to address shortages in clinical radiology and oncology? Thank you.
I think there are perhaps 2 points worth mentioning before I then come to the point about the future of the workforce. Last year, we saw over 94% of people with brain and central nervous system cancers within our target from suspicion to first definitive treatment. So actually, that's a very high-performing overall percentage. It doesn't mean if you're someone on the wrong end of that it isn't a really difficult circumstance. And even if you're referred and treated within our target time, it doesn't mean that it isn't potentially a difficult experience. That's why the point I made about clinical outcomes, but also about the person's experience on outcomes. In the last study done over a significant period of time, it showed a 13 percentage point improvement in 1-year net survival. So we are getting better. The challenge is how much faster can we deliver improvement in the future. And that does rely on continued investment in the kit. So the point about imaging, and of course we have an imaging academy in Wales, and we continue to invest in that new diagnostic and imaging equipment. But more than that, the imaging academy that's being created is actually about how we train and keep our staff. Now, later today, the Cabinet Secretary for Health will make a statement about the training of healthcare professionals. We have consistently, over a number of years, invested in training the maximum number of staff that our system can do here in Wales. And that is paying some dividends. The challenge is demand is increasing at such a significant rate. We need to carry on investing in the workforce, in the people that need to do the job, whilst at the same time seeing where there are more resources to be able to do that more successfully. It takes in a wide range of areas. Part of the reason why, when you think about this whole piece, I'm really proud that this government is going to deliver a new medical school in Bangor from this autumn with its first intake. That's a significant step forward for all of us. It takes years to get to the design point, years to make the case, and then the significant financial investment. We will benefit, though, from that return, in addition to the wider work we're doing in the whole workforce. As ever, that takes resources, and I hope we'll have a bigger resource base over the course of the next UK parliamentary term to deliver on that.